Welcome to RAA's webinar on zoonotic diseases. My name is Efremia Constantino and I'm honored to be your host today. So our webinar today is called Salmonella Under the Microscope, Tackling Outbreaks and Enhancing Food Safety in Europe. Here is the agenda for today. We have an outstanding lineup of speakers who will share their expertise. First, Rodrigo Scottini will give an introduction to the Infectious Disease Alliance. And then we have more in-depth discussion with Dr. Carmen Savelli, Dr. Steen Ethelberg, and Dr. Marianne Shemali. We will also have a Q&A session where you will have the opportunity to engage with our experts on key challenges and solutions in the fight for a safe food system in Europe. Anyone who has a question can write on the chat, or they can raise your hands, and I will give you the opportunity to talk during the Q&A session. Thank you for joining us in this important conversation, and let's get started. I will now give the floor to Rodrigo Scottini, who is the Executive Director of Infectious Disease Alliance. Rodrigo.
Good afternoon, everyone. Good morning for the ones in the US, or good evening, the ones in the eastern side of the globe. My name is Rodrigo Scottini. I'm the Executive Director of the Infectious Disease Alliance, which is an organization dedicated to addressing some of the world's most urgent and complex infectious disease challenges. So we work through cutting-edge research, technological innovation, and cross-sector collaboration to develop sustainable solutions enhancing global health outcomes. So our focus is on strengthening disease surveillance, advancing treatment options, and advocating for policy reforms that prioritize infectious disease prevention and control. Salmonella infections continue to be a major public health concern in Europe, impacting thousands of individuals each year and presenting a significant burden on healthcare systems. Despite considerable progress in food safety regulations and surveillance system, outbreaks still occur, often associated with contaminated food products, inadequate hygiene practices, or antimicrobial resistance. At the heart of our mission is the belief that collaboration drives progress. By bringing together leading scientists, healthcare professionals, policymakers, and community leaders, we foster a multidisciplinary approach that ensures that our strategies are both evidence-based and locally adaptable. Through partnerships with governmental agencies, research institutions, and non-government organizations, we aim to accelerate the development and implementation of effective interventions that reduce the incidence of Salmonella infections across Europe. In today's discussion, we will have a platform to explore the latest research on Salmonella infections, examine innovative detection and prevention strategies, and identify actionable solutions that can enhance public health efforts. By sharing knowledge and promoting collaboration, we can work towards a future where Salmonella infections are effectively controlled, ensuring safer food supplies and healthier communities. So I will now have a short presentation about the Infectious Disease Alliance, which for many of you is not an organization well known. So as I said, I'm the executive director. I'm based in Copenhagen, Denmark. I'm from Brazil, São Paulo region. And so, yeah, the Infectious Disease Alliance is a global public health advocacy organization. So Europe is, of course, a part of our focus. But not only we have as a vision to reduce the burden and improve access to healthcare, and our mission is to unite civil society. So it's very important for us that civil society is united and we can represent civil society as one voice. So what we do, we advocate for impactful policies and sustainable finance. As you know, finance is a hard issue today. Uniting civil society is very important. Promoting healthcare system strengthening, like the horizontal base of what healthcare is. Fostering cross-sector collaboration and looking at the One Health perspective. Today, it's a very clear example of that. Promoting equity and refined interstate forces is extremely important as well. So what we offer, so if you are an organization out there from civil society and is interested in joining our alliance, we offer an access to critical tools, opportunity for global alignment, support for advocacy and policy, partnership building, and a range of resources to our members. So we are an organization that represents civil society, unify the fragmented community, bring accountability to policymakers, and promote exchange between partners. So as I said, collaborative partnerships is an extremely important aspect of our work. Our members, as I said, are civil society organizations in the like of NGOs, professional societies, and civic societies, patient organizations, also research institutions. Supporters are foundations, private sector, or governments, and engagement partners are international organizations, policymakers, and governmental agencies. So the benefits when an organization joins us is the opportunity of have representation in one of the community areas we have. I'll show you a bit what they're focusing on, participating in events, co-organizing events, getting updates from our lives, but also sharing our organization's updates, get an opportunity for joint advocacy through events, report materials, professional growth, access to resources we make available. So those are the areas we work on. So we have areas related to One Health, zoonotic diseases, vector-borne diseases. So a lot of the areas that are closer to what we're discussing here today. Some of the events we're organizing, those are the physical events at WHA, the European Parliament, UNGA, World Health Summit, and the European One Health Conference in Brussels. So I think for many of you today, this could be of interest as well. Please look at our website. We are actually right now, it's a bit far away in November, but we are now looking at partners to organize this conference. So if you're interested, please let us know. Then they have a list of webinars. This is the second in this year's row. So there'll be many others you can register for this semester, and upcoming also next semester, other ones. Then yeah, so this is our team, the community management team managed by Carl, as you can see here under the name Infectious Disease Alliance. He's helping with the IT today. And have Efremia, who's a community manager working on One Health and zoonotic diseases. And you have other members organizing the webinars, and you can see a little bit a picture about our team. Remotely mostly, but a lot of in Copenhagen and in Berlin. Our strategy you can also see on our website. I won't talk too much about that. And yeah, I think that's it for my side. You can see more on our website, and I'll give the word back to Efremia. Thank you, Efremia.
Thank you, Rodrigo. Okay, I can go back to the presentation now. Okay, so now next we have Dr. Carmen Savelli, who is a technical specialist in the Department of Nutrition and Food Safety on the World Health Organization. And he will talk about WHO's global approach to strengthening foodborne disease surveillance and response. Dr. Carmen, you said you want to share your slides?
Yes, great, thank you. Let me try to do that now. I think you can see that in full screen mode. Is that right? Yeah, I'm seeing some nodding. Okay, wonderful. Let me just start my timer here and add my greetings to everybody. Thank you very much for inviting me to speak to you today. So I appreciate the organizers from the IDA to give me the opportunity. It was my first time also to get to know more about this new organization. So it's great to make those connections and see where we have a lot of common goals. So as mentioned, I'm going to start a little bit broader than maybe the focus of the webinar and talk about WHO's global approach. So thinking a little bit beyond Europe to start and about foodborne diseases and strengthening our systems worldwide, and then get into a little more focus on salmonellosis. So I'll touch on the WHO's global strategy for food safety. We'll talk about a new alliance that WHO launched called the WHO Alliance for Food Safety, speak specifically about our approach to improving foodborne disease surveillance, and then end with a small focus on Salmonella, which I think will set us up for some more discussions from our speakers coming up next. So first, I think you're probably all well aware that access to sufficient amounts of safe and nutritious food really is essential to sustaining life and promoting good health. But unfortunately, we know that unsafe food containing harmful bacteria, viruses, and parasites or chemical substances cause more than 200 different diseases, ranging from things like diarrhea, but all the way to serious forms of cancer. And an estimated 600 million, or almost 1 in 10 people in the world, are actually falling ill after eating contaminated food, and 420,000 die every year. So with that in mind, establishing and strengthening national foodborne disease surveillance systems globally really is critical for helping us to understand and then ultimately reduce the burden of foodborne diseases. And that's in line with WHO's global strategy for food safety. So this is a strategy that was adopted by all member states at the World Health Assembly in 2022 with a vision to ensure that all people everywhere consume safe and healthy food. And so the focus is on strengthening multi-sectoral collaboration and working towards innovative public health approaches that help reduce that burden of foodborne disease. And in terms of implementation, WHO is working with all member states, so that includes those countries in Europe, but really all around the world, 194 member states and other partners, to strengthen national food safety systems in 5 different strategic priority areas. So let me quickly provide an overview of those strategic priorities. The first one is to strengthen national food control systems. So that's really the essential backbone that we're talking about in the strategy. The second one is then identifying and responding to the food safety challenges that are resulting from the different transformation and global changes we're seeing in our food systems. And that could be things like globalization and climate change, the big things that are facing us these days. The third strategic priority is about increasing the use of food chain information and scientific evidence in making our risk assessments and risk management decisions. So really trying to strengthen data generation and data use. The fourth one is about strengthening stakeholder engagement, working with our various partners and also improving risk communication. And the fifth one about promoting food safety as an essential component of domestic, regional, and international trade. Again, we know that our food system really is globalized and it's an important part of countries' economies. And so how do we make sure that food is safe and international trade is not interrupted? Now, all of those are underpinned by international cooperation. So it's echoing a little bit what we heard from Rodrigo in terms of the importance of partnerships. It's so important in food safety as a multi-sectoral area that we really are working across different sectors, across agencies, and internationally as well. If we focus in on the first strategic priority and look at one of the strategic objectives, it's to strengthen food monitoring and surveillance programs. And food monitoring and surveillance systems are recognized as a really important and necessary component of national food control programs. And of course, that's because surveillance of foodborne diseases in populations is essential for monitoring the safety of the food supply. Also to identify outbreaks, to help determine the burden of illness, monitor any trends and modes of transmission. Those are all key responses that we need foodborne disease surveillance and food contamination monitoring for. Now, WHO has a long history of supporting member states through various technical guidance and initiatives to improve and strengthen their foodborne disease surveillance systems. But in spite of that, we know that capacities for foodborne disease surveillance globally are limited. Now, one of the indicators in the global strategy for food safety is about capacity for foodborne disease surveillance. And when we look at the baseline from 2022, we see that globally, the indicator is only 1.5 out of 5. So in Europe, it might be higher, but if you look globally, it's actually only 1.5 out of 5. And what does that mean? It means that for a vast number of countries around the world, capacities are either non-existent for foodborne disease surveillance or they're very limited. And so it means that overall, these systems require strengthening. And so I want to talk about some ways that WHO has been working to do that. We recently launched in 2024 the WHO Alliance for Food Safety. And this was really in response to the fact that we needed to consolidate efforts and focus on improving foodborne disease surveillance globally. So this is a global network of WHO collaborating centers and other partners who are working to help implement the global strategy, but also have this initial focus on foodborne disease surveillance and food contamination monitoring systems. And so what we hope is that it'll drive a global initiative that, first of all, raises awareness about the importance of food safety, which often falls outside of prioritization, that it mobilizes resources to support food safety programs and really helps to foster more partnerships between WHO collaborating centers, governments, international organizations, and other partners. So our objectives for the WHO Alliance for Food Safety include creating this enabling environment for multi-sectoral coordination and collaboration to help implement our strategy, like I said, focusing on surveillance in the first instance, advocating and promoting for legal frameworks for foodborne disease surveillance, because we know in many countries, foodborne diseases, including salmonellosis, are not even notifiable. We want to work to build capacity in public health, animal health, and food safety analysis laboratories. And so that means taking a One Health approach. And then generating and sharing quality data information. So data generation, data use on food safety and foodborne disease information. And then really fostering a community within the Alliance, sharing best practices and lessons learned amongst Alliance members. For us, we've developed a work plan together with our steering committee, and now we have some member-led working groups who are focused on these 4 areas, on really trying to get foodborne diseases integrated into national disease surveillance systems, focusing on multi-sectoral collaboration and food safety policy coordination, lab capacity building, and then finally data and awareness. So we're really happy to see a lot of engagement from our members in this new network, and count on their support moving forward to work in these 4 areas. Now, a lot of the work that's being done currently in the Alliance is falling within the framework that WHO has for strengthening surveillance and response to foodborne diseases, which is outlined in a suite of manuals, which you can see here. Now, these manuals explain how countries can improve their foodborne disease surveillance and response systems in the context of the international health regulations. And so across 5 different modules, countries who are interested in improving their systems can seek guidance that allows them to first conduct a self-assessment of their own system, identify any gaps that exist, and then manage implementation of the various steps to build their surveillance capacities. And so depending on which stage of development a country might be in, they might start in stage 1, stage 2, or stage 3. And really what we want is for all countries to work towards building their capacities for an integrated food chain surveillance system that would mean that data from all points along the food chain could be integrated to help inform risk management decisions. And so that means building on capacities for outbreak response, once signals are identified through event-based surveillance and through notifiable disease systems in an indicator-based system, working together across sectors in a multi-sectoral way, and as well having capacity to conduct ad hoc or periodic studies that help identify where the source of infections are coming from. Now, if I shift gears a little bit, in addition to the work we're doing to strengthen foodborne disease surveillance systems at WHO, we also are mandated to regularly report on the burden of foodborne diseases. And so that means cases and deaths and disability adjusted life years, or DALYs. And this was first done in 2015, and that was actually the only time it was ever done, if you believe it or not. And at that time, they looked at 31 different foodborne hazards. And we're very excited because this year is a big year for WHO, because the new set of estimates are going to be released at the end of this year. And so they're going to be looking at around 40 hazards, 40 foodborne hazards, and looking at the new burden. But right now, we're still relying on data that was published in 2015. And so specifically for salmonellosis, we know that non-typhoidal Salmonella enterica caused an estimated 79 million cases of foodborne illness and accounted for 59,000 deaths annually globally based on those estimates. And so this is actually the single hazard that's responsible for 4 million disability adjusted life years. And that's the largest number of those foodborne hazards that were investigated, and a quarter of the disability-adjusted life years due to foodborne diarrheal disease agents. So it's a significant factor, and that represents 13% of the total DALYs due to 31 food hazards from 2015. So that's to put in context that it's important that this webinar chose to focus on Salmonella because it was and remains a very important and major foodborne hazard. And what's also really important is that for the first time at WHO, we've now got included as an indicator in our what's called the General Program of Work or the Global Health Strategy for 2025 to 2028. So that's the big overarching global strategy that all member states have agreed to, now includes for the first time an indicator on salmonellosis. So for us, that's great because it means that there's getting a bit more visibility and prioritization, and we'll start to be reporting back to member states on the proportion of people who've suffered a foodborne diarrheal episode of non-typhoidal salmonellosis. So as I come to the end of what I wanted to talk about, I wanted to mention specifically about an example where salmonellosis doesn't respect national borders. We talk about improving outbreak detection in Europe, but there's an example, if you saw in the headlines a few years ago, where an outbreak of more than 150 salmonellosis infections were identified across 11 different countries that included Europe, but also in the United States, linked to products that were sent to more than 113 countries. And if we think back to how many countries don't have a good surveillance system, we can probably imagine that there was a lot of other cases in different countries that had not been picked up and identified. And so I just wanted to put this example here to remind us of our globalized food system and emphasize how important rapid information sharing across borders is. So that means within Europe, using tools like the Rapid Alert System for Food and Feed, the RASFF system, as well as the global InfoSan, which is the system run by the FAO and WHO, and works very closely with RASFF when there are incidents that cross European borders and involve food that's been exported outside of Europe or into Europe from a third country. And so when information is exchanged through those networks, it enables countries to take risk management measures and mitigate the impact of contaminated food that's been shared abroad. And so this example really, I think, exemplified how important it is for different agencies to be coordinating across sectors, across regions, and in different countries. And so there's many organizations that play a part in facilitating that, and it's just such an important component of incident management when you've got internationally distributed food products. So as I conclude, let me just recap that around the world, national food monitoring and surveillance systems really need to be improved through prioritization and better coordination, collaboration, and integration. And so it's really important that we improve foodborne disease surveillance systems because this will help us to understand what's happening in the global food supply, reduce the burden of foodborne diseases globally, and achieve the targets that we've set out in the global strategy for food safety. So we've got our new initiative at WHO with the Global Alliance for Food Safety, which is established to help us implement the strategy with this initial focus on foodborne disease surveillance. And we're using the different tools we have and relying on our partners and coordinated efforts with colleagues around the globe to try to address foodborne diseases. And we're very happy to see this renewed focus on strengthening salmonellosis surveillance, and including the fact that there's now an indicator to be reported through WHO's new global strategy for 2025 to 2028. And of course, again, while we know that it's important to see what's going on in your own region, that pathogens don't respect those regional borders, they don't respect national borders. And so it's so important that we have these international networks connecting different agencies so that when an incident does happen, communication can be facilitated rapidly to enable risk management measures to be taken. So WHO is going to continue to work in this area to promote work in improving food safety systems globally, supporting member states in their efforts because we know unsafe food still presents, unfortunately, a significant health burden globally, including salmonellosis. So my last slide, just to say thanks and direct you to information about World Food Safety Day if you're interested in learning more about that. This year celebrated on the 7th of June with a focus on science in action. I encourage you, if you're interested, to celebrate and visit the website for more information. So I'll stop there. Thank you very much.
Thank you very much, Dr. Carmen, and thank you for this insightful presentation, very interesting. And now we can move on to our next speaker.
Hello.
Hello. So Dr. Steen, he's the head of the section of food, waterborne and zoonotic infectious at Statens Serum Institute in Denmark, and he will talk about the Salmonella outbreak investigation in Denmark. Do you want to share your slides, Dr. Steen, or should I?
I'm trying to share them. I don't know if you see them.
Okay. Yes.
Yes. All right. So I can start.
Of course.
Yeah, I see my slides. And I see the slides. Excellent. Thank you very much. And thanks very much for inviting me. For me, it's also the first time that I meet you from the IDA, and I think it sounds as a really lovely initiative, and happy to be part of this. So I'm an epidemiologist, as you said, working at the Danish Public Health Institute, which is called the SSI. And officially, we have this little building here, which was the first one built as our logo. The institute is much bigger. But I'm going to show you some slides about the people who worked on outbreaks later, and we all actually sit within this lovely building. But what I wanted to do today is to over the next 15 minutes, give you sort of a sense of why and how we think that outbreak investigations for Salmonella in Denmark are how we do it, and why we think it's important. And then I'm going to, the main part of the presentation is going to be an example of an outbreak investigation that I thought was interesting for various reasons for today. And as we heard from the two previous speakers, Salmonella is actually an important public health problem, and in particular the ability of Salmonella to cause outbreaks is a problem. So it does have simply public health relevance, both globally, but also in countries like Denmark and Northern Europe, to be able to locate the outbreaks and stop them as they occur. But also it's important to do the outbreak investigations because we often see that are again and again from the same sources. So if we get to understand what's happening, we are able to prevent future outbreaks. And I'll try and hammer that point in several times also later on. So first, a little bit about how it's organized in Denmark with Salmonella outbreak investigations. And I think the point of what I'm saying here is really that it's a cross-sectorial endeavor, and agencies need to cooperate in order to actually do outbreak investigation work. So like in many other countries, we have a distinction between local outbreaks, which would be investigated by the medical officer together with local clinical laboratories, but also to a large degree with the local food control officers, and then also the national outbreaks and even the international outbreaks, which are the more tricky ones, where, for instance, we see that there is a type of food that is distributed all over the country, maybe because it's being sold in a supermarket. And in these situations, it is us from the Public Health Institute, from the SSI, that are responsible. But we do the work together with two other agencies, the Danish Technical University, which are, and that's because they are responsible for the surveillance in the foods and animals, and also with the Veterinary and Food Administration, who are also the authority in this. And these three institutions, they work closely together and has done so for more than 20 years. And for instance, we have weekly meetings every Thursday morning where we are discussing the outbreaks that are ongoing and explaining how the investigation is unfolding. And one of the important aspects of this, seen from our perspective, is that because the Veterinary and Food Administration is part of this, they are ready to actually go into action and do something about a tainted food source when the investigation shows that it is actually that food source that is the outbreak. So it's good. It's important to have this close cooperation. So how do we work at my institution? How do we find the outbreaks and how do we investigate them? And I think I could talk a long time about this, and I don't have the time now, but I'll just very quickly say that in a country like Denmark, we have, I think, good surveillance for Salmonella. We get information about cases, even to the degree that we know where they live from the laboratory system. And we also get the actual bacteria, the isolates, sent to us. And nowadays they are then whole genome sequenced, which means that we can do cluster analysis and look for when we have clusters of isolates that would signify that we have outbreaks. And for the actual investigation and the handling of the outbreak, we have a dedicated outbreak center. And here's a photo of how they're working. So the EP people that work on this, they sit in the same office, and on Mondays at noon there are these stand-up meetings where the different outbreaks are being looked at. I don't know if you can see my mouse moving, but this is Luis Müller who's heading the center. And here you see this whiteboard that was also in the background of the previous slide, where we list the ongoing outbreak investigations and plot down sort of the most recent information and coordinate amongst ourselves how we deal with the investigation. So it's a little bit like detective work or police work that you see in TV. And we found that this old-fashioned method is quite nice and a very good way of handling the outbreaks. We do though also have lots of sort of more modern tools. So if you, I just try to list sort of a few elements of this outbreaks and what it is actually that we offer. And I think the two important things are that we have these cooperative structures in the country, but also that the people you saw before, not all of them, but some of them, they actually have outbreak investigation as their job. So they are dedicated epidemiologists working at the institute who are doing outbreaks, not just for Salmonella, but also for other, mostly foodborne infections. But it's important that they have the specialization and the time and the expertise. And we also have another thing which I would think is quite important for us. We have an interview center with students who come in the afternoon and are able to call the patients and get information from them, because that's part of the way how you do the investigation. You need to talk to the people who have been ill, and that can be really time consuming. So we have a body of students who think this is lovely, and then they also learn something about our work and have the possibility to call people. And then we have sort of a toolbox with lots of different other tools in it, and I won't go through these now, but it's stuff that we have built up over the years that enables us to sort of in a structured way and fairly quickly work on outbreaks. So I'd like to take you through this one outbreak investigation, which I think is interesting, as I said, for a number of reasons. And I want to take it back to 2011, but it actually has repercussions up until now, as you will see. It's a Salmonella serotype that is called Strathcona. And before this outbreak, it hadn't really been seen at all globally. There'd been less than a handful of cases ever reported and no outbreaks. So, and back in 2011, it was myself and Louisa who were actually doing all these investigations. So I remember this quite vividly because I was also the one calling the patients and talking to them. But we got the alert in September on a specific weekday because our lab called us and said they've seen this Salmonella serotype Strathcona with 3 cases, and it was like never seen before. So please look at this. And we started calling people, and we have a long questionnaire that we use for this, with all kinds of questions about things you might have been eating or doing, which could have given you salmonellosis. And even though we asked all these questions and put them together, we didn't really see it. So we could see that it wasn't pork or chicken or eggs or foreign travel or some of the usual suspects. But even though we talked to some of these patients many times and kept asking them questions and really interrogated them, we didn't come up with a good hypothesis of what it could be. We did note though that they had tended to use 2 different supermarket chains only. And so we started to use a method that we had some experience with before, but not so much, have had a lot since. We asked the patients if they would please go into their web banking systems, and then you can see when they have been using their plastic cards to pay for food in a supermarket. And then tell us the date of this and the supermarket branch, because that they could see. And then also the exact amount they had paid when they used the card. And we then went back to the supermarkets, and with these 3 parameters, they could actually find most of the purchases, and they could recover what you see when you get this little piece of paper that you get when you've been shopping, been paying for the goods in the supermarket. So we put those together. We managed to get 15 patient households, 15 families, most of these the patients were kids, to participate, and then we got information from these 2 supermarket chains. And supermarket B wasn't so interesting because we didn't really see anything that they had in common when they've been shopping. But in supermarket A, where we got 10 families involved, we saw in particular 2 things. So 8 of the families have been buying cucumbers or tomatoes. The cucumbers were 3 different types, locally produced, so that fell apart a little bit. But the tomatoes, they were a distinct type of tomatoes that was actually only sold at this time and in this supermarket chain. And they were imported. And at the time, they were sort of new on the market in Denmark. They were sort of cherry tomatoes or vine tomatoes that we in Denmark sometimes called by the Italian name Tatarino. And they are small elongated tomatoes. And this is what these families had all bought. So this was actually quite significant, and it really told us that this was the food source. Nevertheless, we also did a case control study to further corroborate this. This was true with 25 cases and 56 matched control persons. They were telephoned and asked questions about what they've been eating, and you could see a high match-touch ratio for actually shopping in supermarket A, which told us that there must have been something in that supermarket chain that caused the outbreak. And for questions about tomatoes like this one, have you eaten small elongated tomatoes? We saw a very high odds ratio also. So that further corroborated that it was these tomatoes that caused the outbreak. And then we started to get reports of other countries in Europe where there were also Salmonella stracuna cases, which was, as I said, quite distinct because it's an extremely rare serotype. And we're still back in 2011. And if you see the combined EPI curve here, it was at the same time, and you can see by coloring the different countries that were involved. So most cases in Denmark in blue, but also cases in Germany and Austria and also Italy. So these tomatoes, they could be traced back. They were sold in this period where the patients appeared, and we could ask the supermarkets and the Danish food authorities to figure out where they came from. They were produced in Italy and in Sicily. And when the German and Austrian authorities were told this, they could also see that the same tomatoes had actually been delivered to the areas where their patients were living. But we never found the Salmonella on the tomatoes, but we are quite certain that these tomatoes caused the outbreak. And it's described in this paper, if you're interested, which came out a couple of years later in Epidemiology Infection. But then the story didn't actually end, because then it was quiet for a few years, and this is a time axis that goes from the beginning of 2017 up until the end of 2024. And you can see these little lines there, they're all individual cases. So there was an outbreak again, a few scattered cases, but then an outbreak again in 2020, and then we saw an outbreak again in 2022, and again cases in 23 and 24. In 20, we also did an outbreak investigation and also pointed to the same tomatoes. And the particular thing about the recent cases is that they have also been seen in other countries. That's just a phylogeny, let's say that, here to say that it is actually very closely related. Also, when you whole genome sequence these isolates, they are quite closely related. So it is really the same type of Salmonella that is appearing over the years in Denmark. But as I said, there were also cases in more European countries, which led to a trans-European outbreak investigation. And that was partly coordinated by ECDC and also supported by EFSA. And ECDC and EFSA, they, when there is an outbreak threat, they put together these situation reports here known as rapid outbreak assessments, where they do risk profiling and show the information that's available at the time in a structured way. This came out in the autumn here of last year and describes this now large European outbreak, which is associated with the same tomatoes. And if you go into that, you can see a table here to the left of the countries that have cases. So cases in particular appeared in Germany, but also in Austria, and then in the UK and in France. And there's an epic curve going back to the Danish outbreak that you see in 2011, which was the first time we recorded these cases. Again, the coloring is the different countries. And then there was a little bit of cases over the years, all at the same time of the year, all in the autumn. And then it sort of accelerated since 2017, and there were even cases during the pandemic. And now we had an acceleration again here to a large degree in 2023 and 2024. So I think there are some learning points to take out of this, and this will be my last slide. And one is that obviously tomatoes is not, at least not what I would expect that to cause outbreaks. Some years ago, we also just saw chocolate. There can be salmonella in many things, and it's not just meat products. And certainly tomatoes is a good vehicle for salmonella outbreaks. Also, that outbreaks, if they are not sort of stopped by their source, they may come back, and outbreaks may show themselves in the same form from the same type of food over and over if this basic food source is not controlled, as it hasn't been in this particular outbreak yet. And I think that is one of the reasons why it's important to do this thorough investigation, so you actually get proper evidence of what is causing the outbreak, so you have something to act out on. Also, you have to sort of do things that crosses borders or affect large companies, which is sometimes problematic, right? So we need to have the evidence in place and be certain of what we do. So good investigations is a good thing. And I think this example of using these consumer purchase data investigations, where we use data from the supermarkets, is an interesting way of having an extra tool that may help to get to the root of an outbreak sometimes when it's difficult to do when you just talk to the patients, because they very often don't remember what they've been eating. And then, as we also have before, outbreaks are a problem in a globalized world where we ship foods across borders, and then we also ship the diseases across borders. And it's important that we work together across borders also and have a globalized system or at least a regional system across borders to fight these outbreaks. And it can be difficult to intervene against the food processor in a different country than the one where the cases are appearing, as we have also seen in this outbreak. And again, the most important thing is to have cooperation and international cooperation, but also national cooperation if you want to work with investigations. So I think this was what I wanted to say. Stop sharing. Yeah.
Thank you so much, Steen, for your insights. It was very interesting. And now we can move on to our next speaker. Hello, Marianne.
Yes, hi. Hello, everybody.
How are you? Good. Okay, so our next speaker is Marianne Shamali, who is the Scientific Director for Food Safety in the French Agency for Food, Environmental and Occupational Health and Safety. Marianne, do you want to share your screen?
Yes. Is it okay? Can you
Yes.
see the screen?
Yes, we
Okay.
can.
Well, it's too small for me. Anyway, yes. So
If you
hi again. Yeah, maybe I can switch
to the present mode, it's in the bar down the screen.
Well, I'll try like this. Don't worry.
Okay.
Well, so hi again to everyone, and thank you very much for the invitation. As my predecessors, it's also the first time I work with your alliance. So I wish you the best. Through my presentation, I will take you to France, where you will see also some similar things, since we are in Europe. Similar aspects shared by Steen in his during his talk. Okay, so I'm from ANSES, the French Agency for Food Safety. No, it's not working properly. Let me. Yeah, okay. The French Agency for Food, Environmental and Occupational Health Safety, which is called ANSES. And quickly, before I step to the core of the presentation, I present quickly to you the main missions of ANSES. In ANSES, we have reference activities, since we host EU reference labs and also national reference labs for different hazards. We have surveillance activities through the food chain from farm to fork. And expertise. Many scientists contribute to different working groups and panels at the EU and international levels. And also to support all these activities, we conduct research projects, all of this in a One Health context. So to come back to Salmonella today, in the EU, the Salmonella monitoring is laid down by this regulation that you can see on the screen, and the surveillance of Salmonella and Salmonellosis is, as you can see, mandatory. And this surveillance cannot be done by one simple institution. As you can see here, at the EU level, many actors are involved because we have the human side and we have the veterinarian side, we have the risk assessors, and we have also the risk managers. So to put all these actors together, we have so the ECDC at the EU level, which is involved in Salmonella investigations at the human level. They are involved by conducting the investigations and collecting also the strains for characterizing them. Whereas at the veterinarian side and the food chain side, we have EFSA, the European Food Safety Authority, who takes care of assessing the risk, analyzing the data, and also report annually about the zoonosis. Many of you must know, I think, the EU summary report about zoonosis, and also contribute to the epidemiological investigations in case of outbreaks. For the technical aspects, the EURL, the EU Reference Lab, coordinate the national reference lab from different member states. The URL coordinates the activities. And also with the national reference labs, they ensure that the methods used for Salmonella isolation, identification, characterization are the most appropriate ones, and also they, in case of outbreaks, the EURL has the different contact points from national reference labs to solicit them and ask for data, ask for strains, and make the link between the authorities and the national reference labs. And last but not least, we have the DG Santé, who is in charge of the risk management at the EU level. And in France, we have the same figure, meaning that we have different mirror institutions. The National Reference Center in France and Santé Publique France work on the human side. National Reference Center is responsible of strain characterization and strain collection, genomic surveillance, whereas Santé Publique France will take care of the epidemiological investigations, the questionnaires, contacting the patients, etc. And from the food chain side, we have the National Reference Lab, who will do the same, but at the food chain, to collect the data, analyze the strains, the characterization, and also contribute to the epidemiological investigations. And the food authority responsible of managing the risk is the Ministry of Agriculture, more specifically the Directory for Food, General Directory for Food. So, putting all these actors together, this is the kind of data we can collect annually, and the kind of reports EFSA and ECDC share annually. I guess many of you know this figure, where you can see that salmonellosis is the second major zoonosis transmitted by food in Europe, and also in France, as you can see here from this figure. And the follow-up of through the years show that salmonellosis in the EU is quite fluctuating, since we have sometimes a drop like here related to this shutdown after the COVID. Then we have now a kind of re-emergence and an increase. So this the surveillance, the monitoring of Salmonella throughout the years will allow to have this figure and to monitor any emergent serotypes in humans related to a specific food and so on. So in France, we have also the same kind of monitoring from the human side, and we know that the notified cases are always underestimated, so as the case at the EU level, without going too much into details. But this is an important information to know, that behind the notification and the notifications and the estimation of the number of patients, we have always an underestimation. When it comes to the animals, to the monitoring at the animal level, the monitoring is laid down by a specific regulation, which is here on the screen also, stating that 5 Salmonella regulated serovars must be controlled. So if they are found, if one of them is found at one step of the poultry production, then measures are mandatory to be taken by the food authorities. And this monitoring also at the flock level is published annually by the European Food Safety Authority. So I put here the link if you want to know more and have more details about this. So you can see this kind of figures, the estimated prevalence by member state and within a specific poultry production. And you can also have this kind of figure at the right. So sorry, I'm not sure you see when I highlight something with my mouse. So the other kind of figure here is related to the kind of attributing sources, where you can see the most important, the most prevalent serotype, like here, for example, Salmonella Enteritidis, in a specific poultry production, which is here, is the layers. Salmonella infantis in broilers, and so on. And in France, we have also the same kind of monitoring at the flock level, reported by the National Reference Lab. Here you can see all the isolates throughout the years, and this baseline indicates the percent of those regulated serovars among the total serovars received by the National Reference Lab. So to summarize the possible control strategies conducted at the EU level and also in many other countries in the world, you know, the regulation laid down in the EU since the 90s have really proven to be efficient, although we still have outbreaks among flocks and also among humans. But thanks to those regulations, we know that the situation is under control, although we still have outbreaks. Many countries vaccinate the animals at the breeding level to control the spread of Salmonella at the lower steps. And also it proved to be efficient, but not alone. It should be linked to many other breeding practices. Without going too much into details, such as the feed decontamination, the carcass decontamination at the slaughtering level, or scheduling the slaughters, meaning that the contaminated batches should be slaughtered at the end of the day to avoid cross-contamination during the day. And also other tools like the process hygiene criteria or safety criteria that are applied at the slaughtering level in the EU to control what will arrive at the end in the kitchen of the consumers, to ensure the safest product that will reach the consumer. And I would like to share with you that in a recent expertise I contributed to, conducted by FAO and WHO, we reached this conclusion that to fight Salmonella, we need to put together several intervention strategies and not only one, based on experience from member states, based on literature research and on scientific results. And this is what also I put here in this figure, meaning that to fight Salmonella, many actors should work together, as seen at the beginning of my talk, that many institutions contribute at the human level, at the veterinary level, and also between risk assessors, producers, and risk managers. And this is illustrated here by this hurdle technology, meaning that if Salmonella would escape one step, it should not be possible at the step at the coming steps after this. The aim is to how can I say, it's to to control it and to avoid reaching the consumers and outbreaks at the end of the day. And before I finish my talk, I also stressed by a case study to show you the importance of collaboration between those different actors. And I start by this to tell you that in France, Salmonella is still the major foodborne pathogens among all foodborne diseases. In this figure, we have all foodborne diseases, and Salmonella is still the major one. And this is just to indicate that we have quite an increase in 2022, which was the highest number reported of outbreaks since the start of the monitoring in 1987. And the recent case study I choose to share with you is a multi-sectorial one, a cross-sectorial case, like the one that has been shown by Steen, but it is another outbreak. To show you that at the French level, Santé Publique France, who conducted the investigations in the country, and the National Reference Center, who collected the isolates from the patients and characterized them by WGS, whole genome sequencing, together with the National Reference Lab, who had the strains in its database. Thanks to the coordinations between all of these actors, we identified that the problem, the serotype was Virco, a Salmonella Virco, occurring in the chicken broiler chain. The questionnaire led to few kebab restaurants involved in the outbreak, not only in France, but also in different other countries, since we had 210 cases in Denmark, France, Germany, Netherlands, and even one case in the US. So thanks to the systems that have been presented before, the rapid outbreak assessment, the system conducted by EFSA, and also InfoSant, since we have this case in the US, we put all the knowledge together to stop the outbreak. Although all these efforts put together, we identified that the kebab meat was the cause and possibly coming from contaminated flocks. But unfortunately, in this case, the clone is still circulating because it was not possible to find the one origin, like, for example, one producer or one feed ingredients or something to stop it. The hygiene guidelines have been applied within the meat chain, but not at the poultry level, because it was not possible to identify the origin in this specific case. So I come to the end of my talk, and I draw these conclusions that salmonellosis is still a major zoonosis. It is still the second zoonosis in Europe, and the first case of outbreaks in France, in outbreaks. Poultry is still an important reservoir, but not only, because we know that thanks to the regulations set up, there is the situation is under control, although we still have some outbreaks, but also in many different cases, poultry is not the only food chain or food production involved in the outbreaks. So I point out the importance of monitoring from farm to fork the presence of Salmonella, and to collect the isolates, to characterize them. It is an important and a critical step to avoid critical situations. The regulation should be revised. I didn't have time to speak about the importance of revising the regulations, because today we have 5 serovars regulated in the EU, but not all of those 5 are occurring at the same level. We have always the most important ones, Enteritidis, Typhimuriums, and its variants, which are always at the top level, but the 3 others are not always in the top 5 of outbreaks, meaning that it is important to revise according to the real situations. The importance of conducting of using molecular methods such as the WGS for conducting epidemiological investigations. It's really very precious as a tool. And we know that in France, at the EU level, the surveillance system for Salmonella is well established, although we still have, of course, improvements to do. We are never, the system is never without some shortcomings, but we need to go further and to correct the shortcomings and continue to improve and implement at the EU and national regulations throughout the food production chains in general. And also, as I showed you in the picture before, all the actors are involved, and even the consumer is responsible also to protect himself or herself from outbreaks from salmonellosis, meaning that the hygiene at the kitchen should be also respected to contribute to the protection of the consumer himself, or and also the responsibility of the stakeholders, and the national food safety authorities to educate on one side, and the consumer at the end of the chain to protect himself by using the best hygiene practices that are communicated regularly. And I would like to acknowledge all the people who helped us daily in producing this work and contributing to protect the public health from Salmonella. And I would like to end my talk by this communication about a conference which will be held in France, in Saint-Malo, an international conference on Salmonella and Salmonellosis. So if you would like to continue to discuss about it or to learn the recent advances on Salmonella and Salmonellosis, please note the link. It is still possible to submit abstracts until the end of this month, and also to participate in the conference. Thank you very much for listening to me.
Thank you so much, Marianne, for your insightful presentation. And yeah. Okay, now we will move on to the Q&A session. I see there is a person who has raised their hands. So yeah, do you have a question? Is it Karen? Do I pronounce it correctly? No? Okay. Okay, so I can proceed to a question that I have for all three of you. That could be, what are the challenges when it comes to the cross-border Salmonella outbreaks? Like, how do you manage the cross-border control? If anyone of you want to answer.
Control or investigations. The control actually is under the risk manager's remit.
Okay.
But as I'm talking for ANSES and in France, first of all, the contribution to the investigation is facilitated by different manners, because we have the system to monitor within the country. And if it comes that other countries also have the same notifications, then it becomes a cross-border investigation involving the EU institutions like ECDC, like I showed in the presentation, EFSA, and if it's larger, then through Infosan and the authorities of the countries identified, we share the knowledge. We collect the data about the isolates collected through the different centers, the National Reference Lab, the National Reference Center, the investigation at the lab levels involving the WGS system to identify if the strains coming from humans are the same, the one coming from the field, from food, and from animals. It is important to show the evidence scientifically using WGS. And then in parallel, the epidemiological investigations conducted by the epidemiological institutions in relation with the patient. And then also we have the risk managers associated also to this to the investigations, who will take the measures to inform, to withdraw the product if it is identified, and take the decisions to mitigate outbreak.
Okay, thank you. And I think Steen and Carmen also want to say their opinion on that. Who wants to go first?
Yeah, so I can say something quickly. I suppose your question also relates to how human outbreaks are sort of investigated across borders, because obviously there are rules for control of food when they are exported, and in the European Union, of course, there are particular rules because we have an open market, so we don't try to check each other's food too much. So there's a free flow of food within the EU, which can cause outbreaks across borders, which is of course also the reason why zoonotic infections has been recognized as a thing that the EU is interested in since the 90s. I think depending on where you look, there are different ways of working together on establishing that you have border outbreaks that cross borders, and as we just heard, one of the fantastic breakthroughs is the whole genome sequencing, which can really be used to type the bacteria to the degree so you can be quite certain that it's the same clone that are causing outbreaks in different countries, and thereby you can link them. Within Europe, it's ECDC that coordinates, but I think a lot of the possibilities of having good results also lies on the good cooperation between the public health institutes and the different member states. One of the things that is certainly helping here is the ECDC fellowship program, the EPIAT program, and the UFAN program, because we have so many people now that work with outbreak investigations that have been trained in this and know each other and form a network and are able actually to cooperate. So I think that's sort of at the sort of human level, this certainly also helps. It can be, as we saw in these outbreak examples, quite difficult sometimes to intervene or to do an investigation within a food producer in one country if this investigation is not thoroughly supported by the authorities in the country. That's not always the case. So we've seen, and I don't want to blame anybody, but we've seen these incidences, for instance, with the chicken eggs that were produced in Poland, and more recently also chicken products produced in Poland, where they are produced quite cheaply and sold throughout the Union. And when there are difficulties with these eggs and salmonella in them, you can have very, very large outbreaks with many, many thousands of people getting ill around the Union. And it's difficult if for the European Commission and for IFSA to do something about this, really, we see. So I think as it's not a perfect world, and it's not always possible actually to have the most efficient approach in these situations. Right? So there's still lots of political work to be done over there also. And then so stop talking now. I think in my experience, when we had difficulties at European and national level with food producers, I think it's actually a positive attitude, explaining your case, going into dialogue and trying to work together also with the commercial companies. That is the best approach, because when you start fighting each other, it doesn't really do anything good. Thanks.
Thank you, Steen. And we have a question, but Dr. Carmen, do you want to add something on that?
Sure. Maybe just very quickly, of course,
Yes.
agreeing with the other speakers. You know, from my perspective at WHO, I think we can see that when those cross-border outbreaks are happening in Europe, of course, it's easier when everyone is sharing the same regulations and puts the same priority and approach on their response. And we face more challenges, of course, when there's countries outside of Europe that might be involved, or where, like I was explaining, the capacities are less developed. And in many cases, you know, countries are trying to develop their protocols or a food safety emergency response plan in the middle of an outbreak or an emergency, which of course is never the right way to do things. So I think just focusing on, you know, preparedness and working to establish protocols in advance, of course, is one way to to improve the coordination such that when these cross-border incidents happen, national authorities are ready to collaborate with their international counterparts, whether that's in Europe or outside of Europe through the other networks like InfoSan, for example. Thanks.
Thank you. And I will move on to the question. Please, can Dr. Steen reshare the data from the list of countries with age affected by Salmonella stractona? If you can be a bit quick, only Dr. Steen, if it's possible.
I can just share the link to the ROA list here in the chat. I'll just do that now.
Okay, perfect. Perfect. Thank you so much. Okay, so now for, as we conclude this insightful discussion, let's reflect on some key takeaways for today's webinar on the national practices for Salmonella infection and control, the importance on advocating One Health approach and improvement of the foodborne disease surveillance programs at national and international level. Now I want to share with you the call to action plan on Salmonella infections in Europe, which is shared in the chat, so you can find it there. You can sign it. And as the Infectious Disease Alliance, we want to advocate for increased funding and advocacy and action to eliminate the impact of Salmonella infections. I want to stay informed and collaborate. So feel free to share today's insights with your network and explore ways to contribute to a safer food system in Europe. The Infectious Disease Alliance will continue to work in supporting advocacy, research, and innovation to combat Salmonella infections and promote a safe food system for the continent. We encourage you to stay connected, participate in future events, and take action in your communities in your own ways. I want to thank you all for joining this webinar. Thank you for your time, dedication, and commitment to global health. And we look forward to continued collaboration and progress. So thank you all.
Thank you.
I think someone also raised their hands if you want to say something.
Oh, it's me.
Yes.
Hello, everyone. I'm one of the veterinary medicine students from IVSA who has had the luck to observe this webinar. First of all, thank you so much for giving me an opportunity to observe what I have learned from school and epidemiology class and how to see what everything works in the real field. So the question I have today for the three speakers is that, so in Korea, Salmonella is also a really big problem. So for example, recalling what I observed last year in epidemiology class, there was an investigation in a Korean big supermarket about some poultry, and they found out there was 66% of the whole amount was infected in Salmonella. And when they found out the antibiotic resistance of the Salmonella species, they were resistant to like a very high amount of antibiotics. So in Korea, for poultry and also for ducks, not only the prevalence is the problem, but also the really big problem is the multi-drug resistance. So the question is that as an epidemiologist, like, is there any procedures or some solutions that we can think of to cope with problems that are created because of multi-drug resistance? Yeah, that was my question.
Thank you.
Yeah,
Yes.
It's a huge program, the antimicrobial resistance, and I don't can cover everything in a few seconds of answering. But you know, if this is interesting for you, you may rely on what is done at the EU level on the monitoring of antimicrobial surveillance in animals, and the actions taken to lower the use of antimicrobials in animals, because in some way it impacts the resistance of the isolates coming from animals and possibly going to humans. So a huge amount of reports and works are done and published by EFSA at the EU level. I think maybe if you start by looking to those recommendations, I hope you can pick up some easy start actions, let's say, to, yeah, as a quick answer. Maybe my colleagues would like also to intervene.
I think it's an entire very big other issue to go into now. But of course, we just say that one of the major reasons for antimicrobial resistance and multi-resistance in humans is the use of antimicrobials in the food production in the veterinary sector. So this is really something to target if we want to. I mean, we should target it because it's not good for the animals, but we should also target it because it spills over into human medicine. And the One Health approach that we are talking so much about is really a good thing in this instance. But you raise a very relevant and important point, of course. Thanks.
Someone else want to add something? Okay. So once again, thank you for joining, for your presentations, and for the questions to the participants. And yeah, okay. We hope to see you again to our future webinars. Thank you.
Thank you.
Have a nice day.
Bye-bye.